Okay. You can start.
All right. So today we'll be talking about the importance of herbal medicine. You know, gone are the days when herbal medicines during our great grandfathers' times when if you are using herbs, it's like they slaughter animals and then slaughter either a chicken, or a goat, or a sheep, and then they'll add some herbs or make some concoctions and then give it to the people who visit them as medication. Today, herbal medicine has gone through so many modernization phases, and today I am privileged to give you some insight about herbal medicine, or the importance of using herbal medicine. So, what is herbal medicine? In other words, we call it phytotherapy. Herbal medicine is just using medicinal plants for treatment, or herbs for treatment. So, unlike somewhere in the Asia where they use Ayurvedic or homeopathy to treat, here in Africa, the alternative medicine, apart from orthodox medication, is herbal medicine or phytotherapy using phytotherapy for treating people. Now, in using herbs to treat, you see, here at Agbebe Hospital, when you come here, we use plant bases for treatment. Now, it's not like you come here and then we give you plants, or we give you some concoctions for you to go and take. No, that is not what we do here. What we do here is that when you come, you see a nurse, your vitals are taken, and then all your records are also taken to make a profile for you. Then after that, you see a doctor. Now, the doctor is where they will take your histories, they will examine you, and then if there is any investigation that is supposed to be done, you do that investigation. Then after, we couple all together per what you told the doctor, the history, the physical examination he did or she did, and then coupled with some investigations, arriving at a treatment model, or arriving at how we'll use the plant basis or herbs in treating you. So, like I said earlier in my submission, it's not like you come and then we just give you anything to take.
Doctor,
yeah.
In a case whereby some people use herbs to treat instead of English drugs, so like, what is the difference between the two of them, and which one is more better?
Okay. It all depends on, when we talk of herbs, comparing herbs to orthodox medication. Orthodox medication are extracted from herbs or plant bases. So it's an extraction using chemicals to extract the active ingredient in a plant. Whereby in herbs, there's no extraction done. It's a raw herb, so it's either you are using the roots of the plant, the leaf of the plant, or the stem, whatever, you can get the active ingredient more potently. You use that. Now, if you go to Center for scientific research in plant medicine at Mampong. They have a pharmacopoeia where every drug or every medicine that should be used to treat a patient is documented. It's well documented and well researched on. So wherever any qualified, the emphasis is on only qualified herbal hospital or herbal institution is doing. It's not just in today's Ghana, you can't just do any, take any plant anywhere and then use it to treat any, no, because FDA itself has to approve your medication for treatment. So before you even get to FDA, your medicine or your herbs you are using to treat the patient has to go through research. So if you produce a drug today, you have to send the drug to Mampong, Center for Scientific Research in Plant Medicine, for them to test your drug on the albino mouse or mice to see if it's toxic, the components or active ingredients in your medicine is toxic or not, before you get an approval from FDA. So both are good. Both has its side effects. Every drug generally has side effects, because even if you take a drug and then you have a slight headache or you feel like vomiting, it's a side effect. So it all depends on the choice of the patient, why the patient feels he or she wants orthodox medicine or herbal medicine. But to the best of my knowledge, since we are doing the qualified, going through the qualified means and then doing the standard thing, we feel using herbs to treat people is not a bad thing, because it's equally good compared to the orthodox. Just that you have to know what exactly you are using the herbs to treat. Because for instance, you can't tell me hernia, you can use herbs to treat hernia. No, because hernia, its pathophysiology is so different that you can't use it, it won't work. Because hernia is a deformity, it's a defect, it's a weakening. So there's no way herbs can be used, rather you need surgery. So it has its advantages, what it can do, herbs can do, and then what it cannot also do. That is how it is.
So what is the name of this hospital?
Yeah, this hospital is Agbeve Herbal Hospital, and then whatever we do here goes through standard protocols. Standard, even our medications we give to patients here goes through standardization and approval before we use them in treating medications.
So this hospital is fully, herbal hospital? Fully
herbal hospital.
Located at where?
Sotum, Accra.
Sotum, Accra, Ghana.
Accra, Ghana. Sotum last stop.
But do you still have other branches, like other branches in any other location here in Ghana or outside Ghana?
Yeah, so in Kumasi we have a branch at Adakojachi Junction, and then at Ho we have one at Ho near the Ho police station, just opposite the Ho police station. We have one branch over there. So making together with the one in Accra, we have 3 branches in our.
Thank you very much. Your name again, tell us your name.
Yeah, my name is Dr. Abdurrahim Agbeve, a medical doctor here at Agbeve Hospital.
Okay, thank you very much.
Thank you.
That's all. Thank you.
Thank you.